it's a pity. I'm an early riser, so that's a good time for me. But apparently, a lot of people are not the same. Anyway, if I had that time, I could speak on and on, but I made it short for 10 minutes. But I can elaborate more on the items that we'll be discussing, and I hope we have shared a discussion together. So this talk is about AI, same patient, new management strategies. We all know that AI is the new era that we are all heading to. In the medical field specifically, it's not that robust like for instance computing and computer science and that kind of thing, but it's going on rapidly, progressing rapidly. So I think in a couple of years we'll be using AI in a lot of our tools, and I'll show you today that we have been already starting to use AI in many things, and there are published data already talking about AI and its management and of patients and its use in diagnostic utilities and etc. So this is my agenda. It's an introduction to the AI in cardiology and some case studies and the progress and what will happen to our medical practice in the future, and final remarks. Why AI is used in cardiology? Because cardiovascular disease is apparently the leading cause of death in globally. So this is the first target to address if you want to use AI in clinical practice and in clinical medicine. The first thing they should use is cardiology, because it's the main cause of death worldwide. And also the traditional strategies often rely on delayed or subjective assessments. So we need more objective or more sophisticated methods for assessing patients and for management of patients. And that's where AI comes in. It provides faster and data-driven diagnostics. It can uncover hidden patterns that we can not appreciate easily, and it can also tailor a personalized treatment program plan for patients. If you see a patient in your clinic, you'll take history and maybe review some labs and some images before making a decision about what to do about this patient next. But AI incorporates many other things. It incorporates the biometrics of the patients, not only the height and the weight of the patient or the blood pressure. It incorporates several things that you cannot even comprehend or use for analysis. It can incorporate the disease phenotyping of the patient. It can incorporate the previous meta-analyses about the prognosis of this disease, about the diagnostics of this imaging modality, about the accuracy of this imaging modality. It also can incorporate the portable device data that we all have nowadays. So we are continuously being monitored by our devices. So this AI can incorporate the data that we can get from the portable device of the patient, and all this can help to personalize a treatment plan for this specific patient and not as general for all patients. So it will be very important for diagnostic accuracy of the diagnostic tests that we use. And in this, I show you two examples. This is a study that was published in 2025 about the arrhythmia detection using an ECG algorithm. And it showed that the AI correctly classified ECG abnormalities and arrhythmias better than ECG technicians and experts in the field. And in the right-hand side, we can see it's also another study in 2022 showing that AI can easily identify the problems and diseases in the imaging, like even the chest X-ray. It can correctly classify diseases and correctly diagnose diseases like any expert. Also, AI can easily be used for echocardiography, for example. This is another example in 2024 European Heart Journal showing that AI correctly quantitated the measurement of ejection fraction in patients, and this measurement was excellently correlated with experts and even with cardiac MRI, which is the gold standard for assessing the ejection fraction of any or any patient with a cardiac condition. So AI can easily classify and measure the ejection fraction as accurate as CMR. And this will impact patients, of course, because this will reduce the human error in calculation of ejection fraction, and will also improve treatment of heart failure and up-titration of medications. This is another assessment using AI in CT coronary, and this is another study published in 2024 in the European Heart Journal as well. It showed that AI can assess accurately the calcium score and stenosis, and even introduce measurements like the CT-FFR and atheroma volume index calculation to the regular CT analysis that we do for the patients. And this, in this study, it correctly classified the risk of the patients into very high risk or high risk or low risk just by one push of a button. In this study in Lancet 2019, AI could detect atrial fibrillation in patients with sinus rhythm, and this is an outstanding thing. It can detect subtle changes in the ECG that we cannot easily comprehend based on a lot of data that was fed into the deep learning system of the AI, and then it can correctly predict which patient will get atrial fibrillation, even though the patient is in sinus rhythm and has not ever had an episode of atrial fibrillation in the past. And the area of the curve under the curve was 0.87, so it is highly accurate. In addition to the diagnostic accuracy of AI, it can also have some predictive ability and give us a long-term prognosis of the disease that our patients have. For example, it can predict the natural progress of cardiomyopathy. In this study in JACC 2024, they got patients. AI can detect which patient will have cardiomyopathy in the future based on just parameters from the biometrics and the cellular remodeling and that kind of thing, and the ECG. We all know that ECG abnormalities happen at a later stage. Usually cells become deformed first, and then there's the clinical phenotype of cardiomyopathy, and then later on when the patients get symptoms, we can see ECG abnormalities like white QRS complexes, left bundle branch block, intraventricular conduction delay, and that kind of thing. But AI can detect the diagnosis of cardiomyopathy before it happens based on a surface ECG, which was normal at the beginning. So it's an early stage detection of cardiomyopathy based on the ECG alone. It also can, in this study, it could predict the risk of having myocardial infarction based on SPECT or PET-CT. So in this study, the data was fed in the AI algorithm based on thallium scanning and SPECT analysis, and then it correctly classified which patient is vulnerable of having a myocardial infarction in the future with a high area under the curve. And also another study in JACC 2024 used the CT analysis data of patients, and also this can AI could predict which patient will get acute coronary syndrome in the future based on just CT analysis of a patient who is totally asymptomatic or has chronic stable angina. They even got like a risk calculator based on the AI, in which you feed the calculator with the data that you get from the CT and from the PET-CT, and then you get the risk of having acute coronary syndrome in the future based on AI analysis of the data that you feed to the tool. Also, it can predict future cardiovascular risk based on non-invasive imaging modalities that we don't usually use, like the fundus examination. This study was published in 2018. It used the data from the retinal analysis of the fundus of patients. And in this study, the AI could properly identify patients who had acute coronary syndrome in the future, before that happened, based on the fundus examination and the retinal assessment of these patients. Another example, AI could detect post-operative acute kidney injury in patients undergoing cardiac surgery also before that happened. So we feed in the data of the patient, and then the patient did cardiac surgery, and then they saw which patient had acute kidney injury, and it was correlated accurately with what the AI predicted before the AKI happened. It also can help in procedural planning. For example, in the TAVI procedure, AI can incorporate the CT analysis of the patients and the model of the valve that you are going to implant, and can predict accurately the paravalvular leak incidence in those patients, and this will lead to reduction of complication rate among TAVI operators. And it's the same with the transmitral valve replacement, transcatheter mitral valve replacement. We can also use the data from the imaging of the patients and incorporate the valve that we're going to put and the size, and this will tell us if this valve will lead to LVOT obstruction, for instance, or not, and also this will prevent complication rate among patients doing this, among doctors doing this procedure. So AI is very important in personalized medicine. It's not about what's right for anyone. It's what's right for you as a patient at your age, with the current biometrics, with the current labs, with the current imaging modalities that you've done. We will tailor a management plan for you alone that could be different from another patient with the same disease having another biometric analysis or imaging modalities. So this will shift the practice, the clinical practice that we're doing currently, from the traditional clinical practice, which is mainly reactive. The patient comes with a disease or a symptom and then you treat it. But AI is proactive. It will predict which patient will have a disease in the future and will start treatment earlier, so that he does not get, or she does not get, the disease that she is vulnerable to. Also, the traditional management that we'll do using is protocol driven. It's a willy-nilly protocol for all patients, but for AI management strategy, it's not a protocol driven. It's personalized data, a personalized management plan for each patient alone. So this will lead to a reduction in a lot of hassle for doctors. I don't believe that AI will replace doctors, but it will definitely reduce the hassle of reviewing patients' charts and admission orders and encounter notes and labs and imaging and previous prescriptions and previous histories. AI can do all this for you. And then you make the decision or the treatment plan for the patient based on the input that you have. And this will lead to less time reviewing the electronic health records and more time spending with the patients. So AI in cardiology can accelerate patients' benefit by analysis of the images, by monitoring systems of the patients, and by improving the physician efficiency. It can help in the decision support system by analyzing large data and predicting complications, and it can tailor personalized plans for patients. So in conclusion, AI is a simple and fast tool that enhances precision in the diagnosis and risk prediction and treatment. It can transform healthcare and can encourage and increase teamwork among different specialties, and increase the time spent with the patient instead of time spent with the labs and electronic health records. Thank you very much.